This first case shows a right knee with the probe on a normal anterior cruciate ligament, and you can see the tension, see it attaching up by the femur up there, and this is what normal would look like. We now have a knee that does not have a normal ACL, and you can see there's a small stump left down there, and we're using an instrument to clean some of that out, and we're going to begin to prepare to do the ACL reconstruction. This is cleaning up the femur a little bit so that we can see exactly where we want to put the femoral tunnel ultimately. Some of this is for clearance for the new graft as well. This is a guide in place, and this is going to help us direct a pin down into the femur. And once we have this pin in place, we go ahead and replace it ultimately with a drilling device, and you'll be able to see the small piece that opens up, and this creates the hole as we pull back and drill in a different direction. Once we've created the socket there for the femur, we just do a little bit of smoothing to make it easier for graft passage and take away any sharp edges that we might have when we put the graft up. This is a passing suture that we're just putting through, and this will be what we are ultimately able to grab and use to pull the graft into position when we're at that point in the procedure. We now have a tibial aimer, and we're putting this in on where we want the tunnel to exit on the tibial side, and we're drilling the guide pin up into the tibia. And then similar to the femoral side, we're going to drill over this to make the tibial tunnel. At this point, you'll be able to see a drill bit begin to exit the tibia, and we make this tunnel, and this is sized for the size graft that we are ultimately going to put in. Here we're just doing a little cleanup to remove some of the soft tissue around the tunnel. And once we have that tunnel cleared, as you can see here, we pass the passing suture through, and it will then be attached to the graft. And we are seeing the sutures now that are attached to the button that you'll see right there, that metal button that goes through, and it goes out the tunnel and ultimately catches on that far aspect of the bone, and this is what holds our graft in the femur. We then tighten it, and we're pulling up the graft. This is a hamstring graft, and it has 5 strands in it. It would be a similar procedure for a patellar tendon or for an allograft. Here we can see the bands of the graft, and we then move the knee and straighten it and bend it to see how it fits in the notch. And when we're happy with it, we then fix the tibial end, which is done on the outside of the knee, so you won't see that aspect in this particular video. But we can see the final hamstring graft right here.